Hello, how are you? Today I'm here to talk to you about the prostate. The prostate is a gland through which the urethra passes. The normal young man's prostate is around 20 grams. But one of the problems men face is what's known as benign prostatic hyperplasia, where the prostate begins to increase in size. And because benign prostatic hyperplasia, which is called BPH, benign prostatic hyperplasia, the urethra is passing through the middle of the prostate, and the hyperplasia occurs from the inside out. So when you have an increase in the size of the prostate, you start to have problems with urination. You start to have difficulty urinating. The flow is no longer as intense. Sometimes you have to force yourself to urinate. Sometimes it starts dripping into your underwear. You have a little incontinence, and generally, the concern is so great that when the person sees this, when the patient sees this, he says, wow, do I have prostate cancer? Take it easy. Why? Because if there are a lot of symptoms, it's usually not cancer because you want to know what the main symptom of prostate cancer is. Well, I'll tell you. The main symptom of prostate cancer is that it has no symptoms. It's silent. Why doesn't prostate cancer show any symptoms? When you find out, you already have it because it occurs on the periphery of the prostate and the urethra is passing inside. So when you have all these symptoms of myxoma, which have nothing to do with cancer, there's a second thing to tell you. The great philosopher Tim Meyer had a phrase that he used to say, one thing is one thing, another thing is another thing. Tim Meyer's philosophy applies very well here. Benign prostatic hyperplasia is one thing, prostate cancer is another. One does not become the other. It's given you a lot of peace of mind, huh? Were you worried that an enlarged prostate could turn into cancer? No, there's no way it could. They are two different diseases. Benign prostatic hyperplasia occurring from the center to the periphery, and cancer occurring from the periphery to the center. They are even different locations. To know if this is happening in benign prostatic hyperplasia, the symptoms appear. So the symptoms of urination, the difficulty in urinating. Every time you urinate a little, then you have to urinate a little again. Then you sometimes have to wake up at night. Because of this, it deeply disturbs your sleep. This is a serious problem because if you get up 2, 3, 4 times to urinate, you end up not having restful sleep that night. This will have repercussions on all your health. 4 times to urinate, you end up not having a restful sleep that night. This will have repercussions on your whole health. Benign prostatic hyperplasia, it's called benign because it's benign from the point of view of the prostate, but it can have a lot of repercussions. So if it's bothering you tremendously to sleep, you have to check with your doctor. You can take something so that you don't urinate too much at night. There are substances, alpha blockers, that your doctor knows very well and that will allow you to accumulate more in the bladder and only unload the bladder in the morning. Let me tell you now about a test that I think will one day go out of business called PSA, which is prostate-specific antigen, which has a gradation. You can go from 0 to 4, from 4 to 10, above 10. It has different meanings, but we're not going to get into that here. I'd just like to tell you that there are several factors that increase PSA. For example, if you ride a horse, if you do horseback riding, if you've had sexual intercourse, if you've ridden a bike, if you've done intense gymnastics, if you've run a marathon, all of this contributes to an increase in PSA. So the PSA increases both in the case of prostatic hyperplasia, which is benign, and in the case of cancer. So there's usually a difficulty increased. Is it cancer? Is it not? And the person is terrified and starts doing biopsies. I want you to understand what a biopsy is. A biopsy is as follows. You're going to make about 18 holes in the capsule of your prostate and see if there's anything there. I want to give you an analogy here. Imagine that I have a pond and I breed carp in that lake. And you're going to visit me and I'm going to show you that I breed carp because the water is dark. I throw a net, and when I pull up the net, there are no carp in the net. Does that mean there are no carp in the lake? No, it doesn't mean anything. because the fish wasn't caught in the net. It wasn't in that place. The same thing happens with a prostate biopsy, because when you do a breast biopsy, the problem with the breast is a lump. You go for the ultrasound and do the biopsy on the nodule, but the prostate doesn't have a nodule. So I don't have a parameter to say here that I'm going to biopsy. I'm going to do 18 biopsies. There are complications. I look it up on Dr. Google. You'll see there are people who are hospitalized for a month, then there's no prostate biopsy because sometimes it can bleed. And when it comes back negative, it's not guaranteed that there's nothing there because you've cast the net. You didn't catch the fish. It doesn't mean that there are no fish in the lake. The fish just didn't fall into the net. You've done the biopsy, but if you're doing the biopsy on one side and the cancer is on the other side, you're not going to catch it. So you have to take this into account when deciding whether or not to do the biopsy. And the biggest problem with prostate cancer, which is the biggest concern, is metastasis spreading. There are studies in the literature showing that biopsy, puncturing the prostate capsule, contributes to the process of metastasis. But let me give you two important parameters. Firstly, only 7% of prostate cancers will metastasize. So the chance of dying from it, but not because of it, is very high. So a person who has prostate cancer can die of prostate cancer, but not because of prostate cancer, because the chance of metastasis is only 7%. So much so that in first world countries, after the age of 65, today the approach is to observe. There are cases in the United States, for example, where people over 70 are no longer operated on. From 65 to 70, there are very big restrictions on surgery. Eventually, every man will get prostate cancer. They have studies showing patients aged 90 and over who died of other causes submitted to autopsy. Do you know how many percent had prostate cancer? Over the age of 90, 100%. All the patients who died over the age of 90 from other causes, when the autopsy was done, when the prostate was studied, there was a tiny little prostate cancer waiting there, because prostate cancer takes 20 to 30 years to develop. So if you were diagnosed with prostate cancer today, it means that last year you already had it, that the year before last you already had it. Now I ask you, reason with me. You're diagnosed with prostate cancer today. Why do you have to operate tomorrow morning? That's something that took 30 years to get to that point. Isn't it better to prepare yourself better for surgery? Isn't it better to eat properly? Have a few days to get your life in order, etc. Then tomorrow morning you have to operate. I don't understand this rush, as many who study this don't understand it. The higher the percentage of free PSA compared to the total PSA, the lower the chance of cancer. So I can have a PSA of 12, but if the free PSA is 25%, for example, that's practically benign prostatic hyperplasia or prostatitis, because those with benign prostatic hyperplasia are predisposed to prostatitis. So I want you to know that one disease does not become another. Benign prostatic hyperplasia is one thing, prostate cancer is another. One thing does not become another. If you're over 65, 70 years old, it's probably the best thing to observe. Don't operate like that. And as it's a slowly progressing cancer, it can't be tomorrow morning. And remember that the more symptoms you have, the greater the chance of it being benign prostatic hyperplasia rather than cancer. There are several foods that are useful for treating the prostate. One of these foods component is lycopene. Lycopene is a substance that is very helpful both for benign prostatic hyperplasia and even for preventing cancer. But lycopene is a fat-soluble substance. It's not a water-soluble substance. What does that mean? There's no point in me drinking tomato juice because tomato juice is in water. It's water-soluble. It won't facilitate the absorption of lycopene. Now, if I eat the cooked tomato from the pizza. It has lycopene. Just having lycopene isn't enough. I have to have lycopene that is bioavailable. In other words, it has to be cooked. The best way to absorb lycopene is when you cook it and take it with a meal. Then with the meal, all the fat-soluble part of the meal facilitates its absorption, but it is an interesting component in protecting the prostate. I hope this conversation has helped you a little.